This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Today we're actually on the road. We made the short drive from Oshkosh to North Fond du Lac to visit the Aurora Health and Wellness Center. We're going to be sitting down with Dr. Tamara Lyday to talk a little bit about integrative medicine. Well, thanks for taking some time with us today. This is a topic that maybe some people have kind of heard about and maybe you've never heard about, integrative medicine. So let me just start with a very simple question, and there's no simple answer. What is integrative medicine?
Well, integrative medicine is kind of like a compilation of different things. It's using Western medicine when Western medicine is appropriate, but it's also adding time-held traditional medicine things like acupuncture, homeopathy, acupressure, nutrition, yoga, things that people don't necessarily equate with something you talk about at your doctor's office, like stress management or spirituality.
Right, but it's so much more than just spirituality. I mean, these are treating your traditional ailments as well, aren't they?
That's correct.
What type of things would you be looking to treat with integrative medicine?
Integrative medicine can treat anything. It can treat something as simple as blood pressure for people who are not interested in using pharmaceuticals to something as complex as cancer. Because of the different modalities and the different ways that we approach it, there are so many different things we can treat. I basically say there's no reason not to see an integrative practitioner because they can give you, even if you love your primary and you love your typical primary care medicine, there's always things we can tweak about your life to make you feel better and enjoy life more.
Right, so it's not always the serious emergency situations. The integrative medicine can really kind of help with the life flow.
That's correct.
Yeah. So a lot of people will maybe look at this as a last resort. I'm going to try integrative medicine, but that shouldn't always be the case. This is something that can actually begin before there are problems.
That's correct. I actually look at it like it's health medicine. You know, it's keeping away from getting a disease. I would love to have a healthy 13-year-old come to me and say, what can I do to maintain my health? As opposed to, getting the 55-year-old with diabetes and hypertension, It's much easier to maintain health than it is to reverse disease. So if I could get my well childs in here, or my well males, that's 45 and doing great, and if I can maintain that vitality and that lifestyle, that would be amazing.
Yeah. So how would an appointment start then? And we'll start with the healthy person. I'm interested in this segment. I heard about integrative medicine. What does an initial appointment feel like or look like when they meet with you?
So the first difference between integrative medicine and your common primary care doctor is the length of the visit. So my first visit is at least 60 minutes. Some, depending on how complex they are, will run to 90 minutes, but hopefully not a healthy individual.
Sure.
My intake form is also a lot longer than a typical primary care. My intake form is 15 pages. And it asks things that you typically don't talk about with your practitioner, like, what does your bowel movement look like? What did your last 3 meals look like? Who do you eat with? What do you talk about when you eat? What does your sleep cycle look like? When was the last time you slept for at least 8 hours? So all the kind of questions that you do every day that you don't think anything of it, that's a pattern and a habit for you, is information for me.
Yeah. I mean, as you're asking those questions, I think I would fail. As I think a lot of people would too. Now when you do your exam, if it's called an exam, at that point, what are some of the tools or some of the things you would do to treat or help somebody?
So the biggest thing is the patient always knows their body better than I do, right? Mm-hmm. So a lot of the things we've moved away from as practitioners is we rely a lot on tests before we've even talked to the patient because we're so time pressed. So the beauty of this is typically I get my diagnosis before I even look at any labs because they've told me things and they've told me things that I can glean that other practitioners cannot. So it's mainly a talking appointment. I mean, some people will combine it with a physical. So I still do, I still do pap smears. I still do breast exams. I still do all of the kind of run-of-the-mill things. But typically an integrative consult is just talking.
Mm-hmm. And when we learn a little bit more about what's happening here in North Fond du Lac with the new wellness center and some of the great things going on here, integrative and functional medicine. What's the big difference between the two?
So super confusing. So you typically think of functional medicine as being like your run-of-the-mill family practice doctor, but it's not. Functional medicine and integrative medicine share a lot of commonalities. Functional medicine basically looks at how can I get to the root cause of the disease by using different testing mechanisms that we use in primary care. Unfortunately, a lot of those aren't always covered by insurance because it's using things like saliva testing to test your hormones, because bioidentical hormones, when they are absorbed through your skin, do not come out in blood levels. So we do a lot of saliva testing, both for, female hormones, male hormones, as well as for things like adrenal levels to check for adrenal fatigue.
Okay. Would you be considered a primary care provider, or would somebody have to be referred to you, or how do we get to meet with you in this office?
So people can establish with me just by calling up and saying, hey, I need a doctor, and they can come in, and my staff is great on the phone, and they'll say, are you looking to see Dr. Lyday for primary care, or are you looking to establish with her for integrative care? Sometimes I have patients that come to me just for one particular illness. So they're a primary, I've seen them and have kind of run the gamut and have no idea what to do with their patient. They'll then send them to me like, hey, can you help them?
Sure.
Can you have them live a better life?
Sure.
And then they'll go back to their primary once I've fixed whatever's going on.
Okay. And one of the main differences people might want to be aware of, insurance, you should always check with your insurance in terms of working with an integrative medicine professional.
That's correct. We do bill insurance. So especially in this area, a lot of the integrative medicine practitioners are cash-based practices. And the beauty of working with Aurora is we are able to bill insurance as long as there's a problem. So if they're coming in with something, or they're coming in for their yearly and they want to see an integrative medicine practitioner, we do bill insurance.
All right. Well, thanks for taking some time with us today.
Yeah, thank you.
Some of this information might be brand new to you, so one of the best ways to learn more is check out the Aurora website and search Integrative Medicine. Of course, you can always give Dr. Lyday a call at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.